Welcome to This Explainer. Today, we're diving into something absolutely crucial. We're going to break down the highly complex biological timeline of alcohol withdrawal, and we'll look at the life-saving science behind medical detox. If you or someone you love has ever considered quitting heavy drinking, you already know that decision. It can feel incredibly hopeful, but also, let's be honest, absolutely terrifying. So today, we're cutting through the noise and bringing some real clarity to that process using the latest clinical insights. Right off the bat, I want you to think about this number: 2 million. According to the National Institutes of Health, nearly 2 million Americans experience alcohol withdrawal syndrome every single year. 2 million. It's one of the most common, yet honestly most profoundly misunderstood substance withdrawal conditions out there. So this brings up a really critical question. Why is quitting cold turkey so dangerous? Look, a lot of people out there think that quitting at home is just a matter of willpower, right? Like you just need to tough it out and push through. But the truth is, abruptly stopping alcohol when your body is physically dependent on it can actually be a fatal shock to your body's systems. It's not about willpower at all. It is entirely about biology. To understand why that is, here's our roadmap for this explainer. First, we'll look at why withdrawal happens. Second, the withdrawal timeline. Third, the danger of DIY. Fourth, the medical detox protocol. And fifth, overcoming barriers to help. We've got a lot of ground to cover, so let's just jump right in. Section 1. Why withdrawal happens, and specifically, the brain on alcohol. So, over time, when a person drinks heavily, the brain adapts to the constant depressive presence of that alcohol by ramping up its excitatory neurotransmitters. Think of it kind of like this. Your brain is constantly mashing the gas pedal just to fight the heavy brakes of the alcohol. So what happens when you suddenly remove that alcohol? While the brain completely loses its brakes, it's suddenly left misfiring in this dangerous hyper-excitable state. And that hyper-excitable state is exactly what triggers alcohol withdrawal syndrome, or AWS. Basically, this is a whole cascade of severe physical and neurological symptoms that kick off when a heavy, regular drinker suddenly stops or even just significantly reduces their intake. I really want to stress this. It is a purely biological reaction. It has absolutely nothing to do with a person's moral character or how strong their willpower is. Now, obviously, not everyone experiences withdrawal the exact same way. Certain risk factors can drastically escalate how severe these symptoms get. Years of heavy daily drinking, that's an obvious one for sure. But a really critical factor is whether someone has had previous withdrawal episodes. In the medical community, this is known as kindling. Basically, it means that every time a person goes through withdrawal, the next time tends to be even more severe than the last. You add in co-occurring mental health conditions like anxiety or PTSD, or poor physical health like liver damage, and those risks just multiply rapidly. All right, Section 2, the withdrawal timeline, hour by hour. To kind of demystify this scary process, let's track the actual biological timeline. Stage 1 hits surprisingly fast. We're talking usually within just 6 to 12 hours of that last drink. This brings on anxiety, nausea, and hand tremors, which a lot of people call the shakes. And while clinical experts might label this stage as mild, for the person experiencing it, it is a blaring alarm of physical dependence. Then, from roughly 12 to 48 hours, we enter Stage 2. The body's vital signs start going haywire. We see high blood pressure, confusion, and a very real risk of alcohol withdrawal seizures. But the absolute most dangerous period is Stage 3, which peaks between 48 and 72 hours. This is the ultimate danger zone for grand mal seizures and delirium tremens. And even after that acute immediate danger passes, people can face PAWS, that's post-acute withdrawal syndrome, where they deal with lingering sleep and mood disturbances that can last for weeks or honestly even months. Which brings us to Section 3, the danger of DIY at-home detox risks. It is precisely during that 48 to 72-hour escalation period that attempting to detox at home becomes a literal deadly gamble. Roughly 3 to 5% of individuals with alcohol use disorder will develop delirium tremens, or DTs, during withdrawal. And guys, this isn't just a severe fever and some confusion. We are talking about extreme autonomic and cardiovascular instability. The body essentially loses control over its most basic life-sustaining functions. Let's put this into perspective with some stark numbers, because this really illustrates exactly why a DIY detox is so incredibly dangerous. Without medical treatment, the mortality rate for delirium tremens can be up to 37%. Let that sink in for a second, 37%. But, and this is a huge but, when that exact same condition is managed under proper medical supervision, that overall mortality rate plummets to under 3%. That is a massive, life-saving difference. Which is the perfect lead-in to Section 4, the medical detox protocol and clinical interventions. That life-saving drop in mortality we just talked about, it is entirely due to specialized medical detox programs. Clinical teams follow a really strict, structured protocol. Step 1 is CIWA-Ar monitoring. Basically, nurses perform assessments every 2 hours during those critical first 72 hours to track symptoms in real time. If symptoms spike, the medication dose goes up immediately. If they improve, they back off so they don't over-medicate. Step 2 is benzodiazepine tapering. These medications calm that hyperexcitable brain we talked about and prevent seizures, but they're tapered off really gradually over 5 to 7 days so there's no abrupt stop. And finally, step 3 is aggressive nutritional rehabilitation. Let's look a bit closer at the why behind these interventions. Because chronic alcohol use just absolutely ravages the body's metabolism, the medical team isn't just slapping a Band-Aid on the withdrawal symptoms. No, they are actively working to prevent permanent neurological damage. See, alcohol severely depletes vital nutrients, so clinicians will immediately administer thiamine, that's vitamin B1, and folate, often right through an IV. They also rigorously monitor electrolytes because alcohol completely disrupts the body's ability to maintain its basic sodium and potassium balance. So again, this isn't just about making the patient comfortable, it is absolutely essential systemic repair work. Finally, Section 5, overcoming barriers to getting help. Even with these highly effective, life-saving medical protocols in place, a lot of people still hesitate to seek the professional help they so desperately need. Why is that? Well, there are a few huge barriers standing in the way. Fear of the withdrawal symptoms themselves is a massive one, even though we know modern clinics manage this proactively. Then there's the deeply ingrained stigma and shame. People often worry about the cost, completely unaware that many major insurance plans actually cover medically necessary detox under mental health benefits. And finally, there's the anxiety about leaving life responsibilities behind, which kind of ignores the hard truth that untreated alcohol dependence creates far greater disruptions to family and work life in the long run anyway. So if you take one thing away from this explainer, let it be this. Alcohol use disorder is a complex medical condition. It's not a moral failing, it's not a lack of willpower. The brain and body are dealing with a systemic emergency that requires a precise clinical response, exactly like any other severe health crisis. I really love how the experts at iRely Recovery beautifully put it. Choosing to detox from alcohol is choosing your life back. It's literally an investment in healing the physical damage left behind. So I want to leave you with this final thought. If you or someone you love is facing this biological countdown, trapped in that cycle of heavy drinking, are you going to let fear and stigma make the decisions? Or, armed with the clinical knowledge of just how safely and effectively medical detox works, will you take that crucial first step to safely reclaim your life?